Ever wondered if lung cancer can affect non-smokers? Today, we're diving into a fascinating medical case that sheds light on this very question. It's a story of modern pathology, precise diagnosis, and ultimately, a message of hope. So, if you're a medical student, a healthcare professional, during a checkup, a CT scan reveals a concerning finding, a solitary mass located in the periphery of her lung. On the scan, this lesion appears as what we call a ground glass nodular hazy cloudy area that stands out against the normal lung tissue. This finding immediately raises questions. What could be causing this? Is it malignant? And if so, what type? Given that she doesn't fit the typical profile of a lung cancer patient, the diagnostic journey becomes even more critical. To get a definitive answer, a biopsy is performed. A small piece of the lung mass is carefully removed and sent to the pathology lab for examination. This is where the real detective work begins. Under the microscope, the pathologists look for specific clues that can reveal the true nature of the cells. The first major clue comes from a technique called immunohistochemical staining. The tissue sample is tested for a protein called thyroid transcription factor 1, or TTF1. The results come back positive. Now, TTF1 is a highly specific molecular marker. When found in a lung tumor, it strongly suggests that the cancer originated in the lung itself. This is a crucial piece of information, as it helps narrow down the diagnosis significantly. But the most telling feature is how the tumor cells are growing. The pathologist observes a very distinct pattern described as lepidic growth. Picture the delicate, honeycomb-like structure of the lung's air sacs, the alveoli. In a lepidic growth pattern, the neoplastic or cancerous cells are seen lining the existing walls of these alveoli. They spread along the surface, almost like wallpaper, without breaking through the basement membrane or invading the supporting tissue, which we call the stroma. The term lepidic itself comes from the Greek for skeletic, beautifully describing how these cells crawl along the pre-existing lung architecture. This no-invasive behavior is the key to understanding this specific condition. The pathologist sees no evidence of stromal invasion, no vascular invasion, and no pleural invasion. The tumor is contained. So, with all this evidence, a 38-year-old non-smoker, a peripheral ground glass nodule, a positive TTF-1 stain, and a pure lepidic growth pattern with no invasion, what is the most likely diagnosis? A term you might still hear, but EYES is the current, more precise classification, according to the World Health Organization. EYES is often called the classic lung cancer of non-smokers, making our patient's profile a textbook example. Let's break down what adenocarcinoma in situ really means. The term in situ is Latin for in its original place. This is the most important part. It means the cancer is pre-invasive. The cells are malignant, but they have yet developed the ability to invade surrounding tissues or spread to distant parts of the body. By definition, EYES is a solitary lesion, typically 3 centimeters or smaller, characterized by that pure lepidic growth we discussed. The absence of invasion is what defines it and, most importantly, what determines its prognosis. It's helpful to think of lung adenocarcinoma as existing on a spectrum. It doesn't just appear overnight. The progression often starts with a precancerous lesion called atypical adenomatous hyperplasia, or AAH. This is a small area of abnormal cell growth. If left untreated, EYES can progress further. The next step on the spectrum is minimally invasive adenocarcinoma, or MIA, where a small amount of invasion, 5 millimeters or less, is present. Beyond that, it becomes fully invasive adenocarcinoma, which has the potential to metastasize and is much more dangerous. Our patient's lesion was caught at the EYES stage, a critical window for intervention. Now for the most important part of this story, the prognosis. Because EYES is non-invasive, its prognosis is excellent. With complete surgical resection, meaning the entire tumor is removed with clean margins, the 5-year survival rate approaches 100%. This is effectively a cure. By identifying and removing the lesion at this early in situ stage, we can prevent its progression into a more aggressive, invasive cancer. This highlights the incredible importance of early detection and accurate pathological diagnosis. A finding that starts as a scary shadow on a CT scan can, with the right knowledge and tools, lead to a curative treatment and a full return to health. It's worth noting that the term in situ is used in other parts of the body as well, like cervical adenocarcinoma in situ, while the concept is similar. Pre-invasive glandular cancer, the specific markers and clinical management are, of course, very different. The positive TTF1 marker in our case was essential for confirming a lung primary. This case is a perfect illustration of how molecular pathology, detailed histology, and modern imaging all come together to provide a precise diagnosis that directly guides treatment and predicts outcomes. It's a testament to the progress we've made in oncology. So, what are the key takeaways from this case? First, lung cancer is not exclusively a smoker's disease. Conditions like eyes are more common in non-smokers and women. Second, the appearance of a ground glass nodule on a CT scan should always be investigated thoroughly. Third, pathology is key. Distinguishing between pre-invasive, minimally invasive, and fully invasive disease through microscopic examination is what determines the patient's prognosis and treatment plan. The term lepidic growth is more than just jargon. It describes a specific biological behavior with profound clinical implications. And finally, this case carries a powerful message of hope. Catching cancer at its earliest in situ stage can lead to a complete cure. It underscores the value of screening and the incredible sophistication of modern diagnostics. This presentation was brought to you by the Sino Medical Association. We hope you found this deep dive into the world of lung pathology both educational and inspiring. Understanding these details is what empowers us as healthcare providers to offer the best possible care for our patients. Thank you for joining us today. If you found this video helpful, please give it a thumbs up, subscribe to our channel for more medical content, and share it with colleagues who might find it interesting. See you in the next video.